Still on the theme of World AIDS Day, a group called Rights to Care has launched the Me First campaign. It's aimed at encouraging men who have sex with other men to get tested. Meanwhile, the South African National AIDS Council continues to lead in the fight against HIV and the stigma surrounding the disease. The CEO of the National AIDS Council, Sandile Buthelezi, and Rights to Care's Chief Operations Officer, Ian Ralph, as well as Advocate Phumlani Kango, join us in studio for this conversation. Thank you so much, gentlemen, for joining us this evening.
Thank you very much. Thank you.
Now, perhaps, Sandile, we should start off with you. I mean, looking at the fact that we still have to say stigma when it comes to anything related to HIV/AIDS means that how far are we and how are we faring really when it comes to breaking the stigma and breaking the misconception around HIV and AIDS?
Yes, thank you very much, Faith. I think we're not doing as well as we thought we'd be doing in terms of fighting stigma, because we never thought that 20 years down the line we'll still be talking about stigma when it relates to HIV and TB. I mean, we've done some work on the stigma index in the country, looking specifically at TB, mainly in the Eastern Cape, and also at HIV. We discovered that there's still quite a lot of both internal and external stigma to the disease. Actually, it's actually perpetuating the spread. So we need to actually work very hard to actually try and break that stigma, because it is an underlying cause that is causing the infections to grow very fast.
And perhaps it ties in very nicely with this Me First campaign. Me First, putting myself first in. Talk to us a little bit about the actual campaign in itself and what it aims to achieve.
Okay, so the campaign originated from some work Right to Care and partners have been doing with men who have sex with men and, in fact, other key populations. But one of the things that we were finding is that although men who have sex with men were coming forwards and being tested, and we were getting good testing numbers, the actual positivity rates were not high, which meant that we weren't actually testing the right people. It was people who were health conscious that were coming time and time again to be tested, which is good. People were knowing their status, but the real people that we wanted to target and get onto treatment were the people who were very hard to reach, the men who weren't really being very open about being in a situation where they have sex with other men. And so that was the group that we really wanted to target through this campaign.
It's definitely a layered conversation, and I saw that you were nodding quite profusely there, Phumlani, which means I clearly agree with what Ian was saying a little bit earlier on. But the stigma, especially around men, I mean, in the beginning it was almost to say, woman, if my woman gets tested, it means that I'm okay, right? So now it's if my partner gets tested, I'm okay. Would you say that that is a pandemic that persists in our society still?
I would say it still persists in the sense that we still not having conversations around testing. So that already tells us that people aren't going out there to get tested together as partners. And also this translates as well to MSM, because a lot of MSM don't go out and get tested, as you said, because of stigma. But we don't have these conversations amongst ourselves as MSMs, like to say that I got tested a month ago, because I won't probably ask the next partner I date when last they got tested. So it translates across all boundaries, whether you're straight, whether you're gay. So I'd say...
Or whether you're a man who has sex with men. And I think perhaps, could we say that, and I'm going to ask this, quite honestly, could we say that perhaps the reason why we're struggling with breaking the stigma is because a lot of the conversations that we're having, we're not having conversations such as, you have sex with men, and we're in a constitution that is democratic, which means that you can have that. It's your right to choose your partner. And because it's your right to choose your partner, you can own that. Are we not talking conversations around ownership? You have sex with men, or you're gay, or you're straight, whatever it is, just be safe in it.
Yeah, I think the conversation also goes back to the whole identity topic, because at the end of the day, the stigma around MSMs is that the minute you identify as MSM, you're already classified as gay. And you don't have to be gay to classify as MSM, or you don't have to be MSM to classify as gay. And I think that's where the problem lies already in society, in that we now make people choose a category. And you don't have to choose a category if you don't want to. You identify how you want to identify. So I think that's where we need to start.
I mean, questions around identity, and perhaps, Sandile, this brings us back to the conversation when, I think it was last year, where the big focus, and even the year before then, was on sugar daddies. If you remember the campaign, and it was about how is it that we can start having open conversations with our young women that you don't have to have sex with a man without a condom for airtime. as basic and as simple as that the honest conversations need to start happening. And now we're finding that the new conversation is on MSM. So clearly, society has become very, conservative, but to the detriment of society in itself.
Yes, no, I truly agree. I mean, the issue of identity, as my colleague mentions here, is quite very critical. I mean, if we don't address those societal issues, they will still have this underlying stigma. We need to allow people to be who they are, but whatever we practice, we need to be as safe as possible at all times, irrespective of your identity.
Yeah, and our women coming forward, and other younger women coming forward, and I'm just saying this because we cannot be repeating the same message every year and not getting results from the message we repeated the year before that. So are we finding that since that campaign of sugar daddies and since the campaigns that we've been propagating the years before, we're actually making strides in winning?
Yes, I think even though not as fast as we want to, but I think we're starting to see something. I mean, I can tell you one of the things that we're now trying to do to approach this is to actually get the young girls themselves to design programs that actually suit them. Because most of the time we as adults and sometimes as scientists or as medical professionals, we always think that we have the solutions for everything. Like what we did these days, for the past 2 days, we got 200 girls around Soweto just to sit and talk and say, and look at the current programs and then say, does this work for us? What do we want? Because look, you're dealing with adolescence. Adolescence in itself is a very difficult phase in the growth and a person is trying to find himself or herself. Now there's HIV, there's quite a lot of things, but then you have the economic issues, as you mentioned, the issues of airtime. I mean, that's why we're trying a number of programs, the conditional cash transfers that we now want to be evaluating. We've put almost 30,000 young girls through the Global Fund, and we'll be starting the evaluation of that program both in KZN, but a number of strategies that are actually trying to address different issues that we think are the underlying factors. But the most important, that's what most of us as scientists or as clinicians think are the underlying factors. Yeah. Let's get the girls to talk for them.
So it's one thing to have a high-level academic conversation about what is going on really with the masses, correct? Yes. And a lot of times we never get to the masses with these conversations. Is this where Me First comes in? Because I won't lie to you, when you say Me First, I'm thinking, I need to understand that I'm more important than anybody when it comes to my health, when it comes to my status.
That's absolutely correct. And one of the things that we're very much aware of is, particularly for MSM, going to health facilities is very difficult because they are stigmatized.
Yeah.
So they don't want to talk about their sexual behavior. And so what we're trying to say through the Me First campaign is, you're important, I'm important, I need to do the things for myself. And I just want to echo what Sandelia has been saying. Getting the people who the programs target to actually design the programs is very critical. Sandelia talked about the adolescent girls, but we've been doing this with the MSM campaign, and we've also been doing it with people who inject drugs. Getting those people to actually design the campaigns that they want to see and they feel part of, and that we can then support.
Yeah.
So it is about putting me first in many different contexts.
But then how do you get society to come out? How do you get MSMs to come out and get their status checked? How do you do it? And I'm not even looking from an urban perspective now. I'm looking from a rural perspective. Is it because a lot of them are in a marital situation? A lot of them have got wives and families, and the idea of going to a clinic or local hospital for this purpose means that automatically society or my community sees me as this type of person, and the labeling starts.
Yeah, that's absolutely correct. And I think one of the tactics we've been trying, and Phumlani, I can talk about it a little bit more, is that we've actually had targeted testing campaigns. But it's not just about testing. It's actually about doing something once you're tested. If you're testing positive, it's about getting onto treatment and making sure that we can walk with people through that journey of accessing the healthcare facilities, and to ensure that they actually get on the right treatment. Remember, somebody who's on treatment and undetectable is not transmissible. Undetectable is untransmissible. So that is one of our goals, but it's also about making sure that people who test negative stay negative. So it's about providing the right information, the right commodities to people, condoms, lubrication, so that they can actually feel safe and understand better the environment in which they're operating.
Yeah, and again, one would say that when it comes to HIV and AIDS and the stigma around it, what we need to understand is the fact that there are strides that have been reached, especially from a scientific perspective, to make sure that you don't have new infections, right? There are certain scientific mechanisms and medicine that's been created for that very same purpose. However, what also needs to come in is the education aspect of it, and perhaps empathy from society, wouldn't you say, Phumlani?
Definitely. It all starts with empathy, as you say. And also at the same time, it also goes back to having these open conversations and these uncomfortable conversations.
Are men open to having these conversations? Because we're having a conversation here as it is about men having sex with men. And those men could be married, correct?
Yeah.
And those men could have families and children, correct?
Yeah.
So how do you have conversations that are society would deem are taboo with men who want to come out and say, I want to know my status?
So you create platforms for them. So which is what my colleagues were saying as well, is that you want to go to the people, so you have to reach them in the ways in which they communicate. So for example, we're in a digital era right now. A lot of people use WhatsApp, even people in the rural areas as well. So the Me First campaign, for example, uses WhatsApp to be able to reach a lot of the people we're targeting.
Yeah.
But also at the same time with WhatsApp, you also have this anonymity where now you can ask me information, you can ask me where I can go to access healthcare as an MSM without having to deal with face-to-face interaction. I don't even need to see your profile picture to know who you are, because you keep that anonymity, which is what we're trying to create, where we have a judgmental-free environment where people can ask for information at any time that they need. It's a 24-hour service, so people can check it out on the website as well.
So if I go onto the website, I'll be able to find the relevant information, and anonymity is a big key.
It's guaranteed.
In this one, it's a guaranteed key. Until such a time, Sandile, that we hope that we get to a time where we can have conversations and really we can break stigma, but also new infections, right? This is where we're going to. We're trying to break new infections here.
Yes. Yes, yeah, that's what we're trying to do. Because as much as we've been able to try and cut the infections, but I mean, in terms of the target, using the baseline targets, we need to cut infections by 75% when it comes to 2020. But
How are we faring?
We're not doing very good. So our target is 88,000 as South Africa. That's what was set globally. But we're sitting at 231,000. And I mean, we've got less than 24 months to go. So it's very difficult. So we really need to reinvigorate, the agency we had when we started around 2009, 2010. I think we've lost that oomph. Now, we really need to try and see how do we get back to that agency. I mean, when we started with the ART program, people then started to see, oh, no, how now I can take ARVs. And we started to be lax as a country and as individuals. So we need to get back to the agency. So it's very tough.
Yeah.
Yeah.
Gentlemen, it's a very honest conversation, but I can safely say that you've got your work cut out for you, each and every one of you on this table. But thank you so much for joining us this evening, shedding some light in terms of where we are really as a society and how we're faring, especially when it comes to MSMs. The CEO of National AIDS Council, Sandile Buthelezi, Rights to Care's Chief Operations Officer, Ian Ralph, as well as Advocate Phumlani Khango, more on this story a little bit later on.